Drugs can also alter our consciousness, so it could make us either hyper aware or do the complete opposite of that. So there are three main classes of consciousness altering drugs. Our first being depressants, second stimulants, and three hallucinogens. So first I'll talk about depressants. Depressants slow down, inhibit, or depress the central nervous system. The central nervous system is our brain and our spinal cord. But how does it do that? Through GABA. So what depressants do is enhance the action of GABA, and GABA is the principal inhibitory neurotransmitter. It is the main inhibitory neurotransmitter in our brain. Next, it results in lowered inhibition, drowsiness, and impaired coordination. It gives you this very calming effect. An example of depressant is alcohol, barbiturates, benzos, which an example is Valium, right? Another example is lorazepam. Benzos are for anxiety or for seizures. When you're having a seizure, the electrical system in your brain is just going so fast. There's just so much going on. When you give someone lorazepam, 5 milligrams of lorazepam, when someone has a seizure, it slows down those brain waves. It calms them down. And some forms of cannabinoids. As I've said, these are used for anti-anxiety and some even sleep aids. Next, we have stimulants. Stimulants increase the activity in the central nervous system. So it does the opposite of what depressants do. Depressants slow down the activity of the central nervous system, but this one increases the activity in the central nervous system. So often, it increases the activity of dopamine, norepinephrine, and serotonin. Stimulants result in increased heart rate, feelings of well-being, energy, and alertness. So something to think about is your fight or flight mode, which is your sympathetic nervous system. Think about that being upped. So examples, amphetamines, cocaine, nicotine, caffeine, MDMA. Clinical use for ADHD, Adderall is a stimulant, narcolepsy, so someone who's sleeping, you're trying to wake them up, trying to make them more alert, depression, or endurance boosters. Next is hallucinogens. Hallucinogens alter your perception. It gives you these hallucinations. You have emotional shifts. It causes distortions in perceptions in the absence of sensor input. Something is not there, but you're seeing that it is, although it's not. It works via serotonin receptors. Examples, LSD, mushrooms, and all this other stuff.